understand that the science says that vaccines prevent death, but I'm triple vaxxed, still got COVID. You're triple vaxxed, still got COVID. Why is the president still referring to this as a pandemic of the unvaccinated?
Well, I think, Peter, there's a significant difference between, and you just experienced this, and not to expose your public health experience, but I can speak to mine as well. I had been triple vaxxed. I had minor symptoms. There is a huge difference between that and being unvaccinated. You are 17 times more likely to go to the hospital if you're not vaccinated, 20 times more likely to die. And those are significant, serious statistics. So yes, the impact for people who are unvaccinated is far more dire.
What's going on with kids right now? Because we keep hearing about a big increase in the number of kids hospitalized and the total percentage of kids hospitalized. But at the same time, we're hearing that if you dig into the numbers, some of those kids are coming in with a broken hand, but they also test positive. So they're not there for COVID.
Right.
So when we're kind of figuring out risk and how bad things are, how do we deal with that?
So we're seeing so much COVID in the community. Everybody who comes in the hospital gets tested because we need to sort out who needs to be in a COVID room versus a regular room. So everybody's getting a test. And just because there's so much of it out there in the community, you're going to have some people who come in, a kid with a broken arm who just happens to have COVID. And it is a challenge right now. I've just been on service at Bellevue the last 2 weeks. Some of our patients, maybe I have a patient who came in with heart failure. COVID tipped them over the edge, but they don't really have a bad case of COVID. Do you say that's with or from? There's this whole gray zone in between.
So it makes it hard to know how worried you should be then when you hear these numbers.
It is. And this is something that, epidemiologists, statisticians are really trying to dig into to figure out how much of this is truly Omicron causing bad lung disease versus you just happen to have it.
Dr. Gounder, so we got vaccinated, boosted, so we can have optimal protection, right? And I want to speak from the perspective of some friends and family, maybe even some viewers that are sitting at home saying, okay, well, I know people that are vaccinated. I know people that are boosted, that are still getting COVID. So why should I go out there and get vaccinated and boosted? Because we still have a large population of individuals that are hesitant. What would you say to them?
That's right. We have over a third of Americans who are still not vaccinated, and that is a real challenge to getting back to a more close to semblance of normal. What I would say is that, yes, we are seeing breakthrough infections even in people who are boosted, but they're like the common cold. They're not landing you in the hospital. These are not people we're having to put on a ventilator.
It's less severe.
Much less severe.
That definition of mild, though, does seem to be a slippery slope, because I've heard some people who you guys say are mild, they're not in the hospital, but they're really, really in a lot of trouble and it's very painful for them.
The way we as doctors define what is mild versus severe is really a question of, do you need oxygen? Do we need to put you on supplemental oxygen? Have your oxygen levels dropped without it? That's how we define it. So you might feel awful, but you're not requiring that extra oxygen.
So when you say we...
Is America prepared that COVID is here to stay?
No, I don't think COVID is here to stay. But having COVID in the environment here and in the world is probably here to stay.
Epidemiologist Dr. Celine Gounder. We love when she's here. She joins us at the table. Good to see you, Dr. Gounder, because you and two other very prominent doctors, Zeke Emanuel and Michael Osterholm, have sent a letter in JAMA, and you're saying, listen, we need to have a new normal. A new normal with COVID-19 does not include the eradication or elimination. We've got to figure out a way to live with this. So what exactly do you mean? Because the Biden administration is saying, listen, we're going to beat this, we will beat this. I think we're all waiting for that ta-da moment. It's over. That's not happening, you say.
Gail, I think we would all love to jump in a time machine that would take us back to November 2019. I think for some people, that means I just want to forget about COVID. I want to go about my normal life. For some people, it means let's eradicate or eliminate COVID so we don't have to worry about it anymore. And unfortunately, if your goal is to save lives, to prevent hospitalizations, we're going to have another strategy.
The estimate is that you'll need about 70%, maybe 75% of the people in the country vaccinating to get that umbrella of herd immunity.
Let's say we get 75%, 80% of the population vaccinated. We may actually have enough herd immunity protecting our society.
You can make an extrapolation from other infections. I say between 75 and 85% of the population.
How many vaccinations do we need to get fully in the arms to be at what the theoretical herd immunity would be in cases crash? Anybody?
Yeah, I think that's going to be a difficult number to give because herd immunity as a concept means you get enough people vaccinated, enough people infected, so that you have a core of protected people that's a blanket of protection over even the vulnerables who cannot. The threshold of herd immunity is a number we don't know yet for this particular virus. We know it for measles, but we don't know yet what that is. We can guess it's somewhere between 7.
That uncertainty is probably the thing that is going to be the hardest thing to grapple with to get this fully in the rearview mirror. So thank you, Braun.
Right now, people should not be walking. There's no reason to be walking around with a mask. The fundamentals are not rocket science. It's universal wearing of masks. The issue in that is to make sure you do whatever you can to safeguard the safety and the health of the children as well as the teachers. Close the bars and keep the schools open.